Hello and very warm welcome to the Arise interview, 60 minutes of big questions about the big stories from the news and beyond with fresh insight and critical analysis. I am Christian Ogodo, live in Nigeria's capital, Abuja. Thanks for joining us. Coming up in the next hour, the coronavirus has presented a turning point for countries to begin to look inwards to search for solutions. Such opportunities abound only if Nigerian innovators and companies can make use of the window of options or opportunities the coronavirus pandemic has presented. There are global efforts in search for a vaccine, but African countries are leveraging on their strengths to follow the line of traditional and alternate medicines. The World Health Organization says research into traditional medicines for COVID-19 should be welcomed insofar as best practices are observed. Today, we'll speak to Nigeria's Minister of State for Health about the country's efforts in the search for solutions to the coronavirus pandemic. Senator Adeleke Mamora coming up in a moment. There's been an advocacy for a global vaccine bond as nations continue to grapple with the devastating effects of the coronavirus pandemic. However, the search for a vaccine has always generated controversy and negative sentiment around the potential harm of people taking part in clinical trials once the research enters its human testing phase. It is still unclear if African scientists are taking part in the search for a coronavirus vaccine. Nigeria has been encouraged to lead the search for a vaccine in Africa. Even the country's apex bank says it is reviewing funding requests by local researchers to support the development of vaccines and drugs for COVID-19.
Greater research and development in Nigeria of drugs and vaccines that would help prevent the spread of this virus, the Central Bank of Nigeria is developing a framework under which grants and long-term facilities will be provided to researchers, science institutions, and biotechnology firms to develop Nigerians' homegrown vaccines. Needless to state that if we wait for foreign countries to develop their own vaccines, we will be the last in the queue to receive curative remedies for our teeming population.
That's the governor of Nigeria's central bank, Godwin Emefiele, there on how the bank is going to support researches into the production of vaccine and, of course, other pharmaceutical companies. And for more on this, I've now been joined by Senator Adeleke Mamora, who is Nigeria's Minister of State for Health. He was a former Speaker, Lagos State House of Assembly, and a distinguished former Senator of the Federal Republic of Nigeria. Very warm welcome to the Arise interview.
Thank you very much. Thanks for inviting me.
All right, let's take it up from where the central bank governor talked about supporting research into vaccine productions and for the pharmaceutical and traditional health companies on how to get maybe a traditional efficacy that will work for the management. We don't talk curative now, do we? How far and how well has that promise, you know, dovetailed into the Ministry of Health and all the other agencies under you for research and cure for COVID-19?
Thank you very much. Let me first thank the Central Bank of Nigeria for that highly welcome move to support efforts into getting a cure, a remedy, a vaccine, what have you, that can mitigate the devastating effect of COVID-19. And that's a step in the right direction. Now, in terms of indigenous efforts, just a couple of weeks back, we had engagement, virtual engagement with local or indigenous or traditional medical practitioners who have made claims as to having some remedies, some cure, as claimed by these practitioners, and some remedies that can mitigate the effect. So, and the whole essence was to look into what we have. Because you recall that a large percentage of our people, particularly in the rural areas, they still patronize these traditional practitioners of medicine. So we wanted to look at these claims. And of course, we wanted to know what the challenges are. And finally, we wanted to see how we can assist, particularly within the context of the global pandemic, which COVID-19 is at this point in time. So, and it was quite exciting in terms of what we discovered. 19 of them participated in that process or in that engagement. And present also were the relevant agencies. These are the Nigerian Institute of Medical Research, the National Institute of Pharmaceutical Research and Development, of course, NAFDAC. In addition, we had the President of the Pharmaceutical Society of Nigeria. We had professors from the academia, University of Benin, University of Ife. These were professors who had a long-standing effort in phytomedicine, that's plant, medicine coming out of plant. So, and all these various agencies that I've mentioned, they had input, particularly with respect to letting them know what is required of them. That is, what requirements do they need to come forward with? And of course, letting them know the processes involved. Because it's not just enough to make a claim. The claim has to be subjected. First, which is the NAFDAC thing. What NAFDAC does essentially is to determine that is this thing fit for human consumption. That's the first thing. Then from there, you go on to do the analysis in terms of components of what you're presenting. And of course, you go on to do what we call the clinical trial. And preceding that, you may have to do animal trial because you want to apply a remedy hitherto unknown. So you want to be sure. Then you also want to be sure that the people you are getting, that is sourcing for the patients, which has to be on
voluntary basis.
Yes.
Yeah.
Because these people have to be volunteers, and they have to. You need to explain to them what is to be done, what could come out of it, and all that, and then you take it on like that. So those are the things that we sought to let these people know. Then, of course, by way of the way we started was to ask each of them to give us the name, remedy, how far it has gone in terms of registration and listing. No, not even trials now. Whether it's even been listed. Then, of course, what does it claim to achieve? Is it cure? Is it just mitigation of symptoms? Of course. Then, of course, we want to know what the challenges are. And some of the challenges mentioned essentially were, one, funding, because these processes, they need a lot of funding. And that's why I started by thanking the central bank for wanting to, yes, assist in this regard. Two is the issue of protection of the intellectual property rights. That is, you don't want a situation where they will come up with their remedies and somebody goes through the back door to get this and then, rename it. So that is not acceptable. So they want to be sure, and of course this requires some legal input. And of course, they want support, in terms of even fast-tracking this process. So we got all this, and then of course we explained to them what they also needed to do. And as it is now, those that came with remedies, we are forwarding. We're still doing the preliminary process to forward this from the ministry, first to NAFDAC and then to other agencies that would need to come up in terms of playing their own roles before you get to the final stage.
Okay, the research process, yes.
Yeah.
I'm aware that you have a department in the Ministry of Health, that is a department of traditional alternate medicine,
yes,
and
traditional, complementary and alternative
medicine.
Yeah.
And they shortlisted 10 of these products that you just explained to Nigerians and the world. They will be going for testing very soon. Can I just quickly ask you the state of COVID organics that came in from Madagascar? If you can do that in 1 minute before we go on break. Has NAFDAC tested? Has NIPRID tested? Have you sent it to other
Let me
agencies?
quickly correct it. We have not even shortlisted. It was just a kind of suggestion that somebody made in course of our discussion, because there must be basis for shortlisting. So we will give everybody a fair chance as to what they have come up with before we even reach that stage of shortlisting. COVID organics that came from Madagascar. Now, this, as we talk now, these products have been sent to NAFDAC and NIPRID, that is National Institute of Pharmaceutical Research and Development, for them to do analysis before.
So you're still awaiting that result?
Exactly.
Okay, Honorable Minister, we're going to take some messages. When we return, we'll be interrogating more on COVID-19 and what Nigeria's government is doing about that. You're still watching the Rise interview. We'll return after the break. Stay with us. You're welcome back to the Rise interview with me, Christian Ogdo. Thanks for staying with us. If there is anything the novel pandemic virus has done, it has exposed the wobbling healthcare system in Nigeria, unleashed economic and social devastation on our citizens. Years past, the Nigerian government has been paying lip service to the funding of the nation's healthcare sector. But since the coronavirus struck and the bigwigs in the country can no longer travel abroad for medical treatment, there's been a renewed zeal to invest more in the country's healthcare system. For medical experts, their concern is how Nigeria can flatten the curve and rapidly curb infection rate. And largely, Nigerians are concerned about the rumored cut in budgetary allocation to the primary health sector in the revised 2020 budget. And I still have with me in the studios the Honorable Minister of Health, State, or Minister of State for Health, Senator Adeleke Mamora. Distinguished, let me start first with this. Have you heard anything about the revised 2020 budget and the cut in the health budget?
Well, we're waiting for the final position from the National Assembly.
You don't know the position yet? I mean, as a former senator and the rest.
When I say we're waiting for anything, you know, the National Assembly, they can rejig. They can rejig the budget. We had a budget before, but because of COVID, that had to be revised. And of course, we still have to go back to the National Assembly, which has been done. And what really happened was that the budget of the various ministries were kind of reviewed, and particularly with respect to that of health, it was reviewed within the ambit of what was available before, and then some added in some areas in order to really address the present issue of COVID-19. That is, address certain issues that will necessarily make us be in better position to manage COVID-19.
Okay, it looks as if, well, the entire world, you know, is just focusing on COVID-19 and leaving other, you know, traditional diseases that I would say, particularly in developing country, in Nigeria, for example, malaria, which kills more people, you know, in the world, developing countries than any other disease, even kills higher than HIV. One would have thought that the Nigerian government will use this period to rejig its health system. Like Boss Mustafa said, the chairman of the Presidential Task Force and secretary to the government of the Federation, that he never knew, I'm quoting verbatim, he never knew that the health system in Nigeria, healthcare system in Nigeria was in this kind of dire shape that we find it.
Well, I think the first thing to say is that no country, no nation prepared for this COVID-19 pandemic. And even countries hitherto thought to be doing extremely well in terms of their healthcare delivery, they were caught napping. So no nation, no country was prepared for this. But having said that, yes, it is still a fact to say that what was on ground hitherto will go a long way in determining how you respond to the present realities. Now, having said that, I think it was against that backdrop that the chairman of PTF made that statement. And that's a statement of fact. A statement of fact is to the extent that in various ways, we still need to do more in terms of allocation, budgetary allocation. If you look at the budgetary allocation to health, it's still below even what the African,
WHO.
not just WHO, but even African Union. But 10 years ago, there was what was known then, still known as the Abuja Declaration, setting aside minimum of 15% of the national budget for healthcare. But we are far from that.
Nigeria has never even achieved 35%
so
of it.
That's a point, to note. Then secondly, there has been a disruption in terms of the healthcare delivery as a whole. You see, ordinarily, healthcare delivery structure is at 3 levels: the primary care, the secondary, and the tertiary. And it's a pyramidal structure. And at the base of that pyramid is primary health. That tells you that you won't have a good healthcare system without that base. No pyramid can stand on its apex. It can only stand on the base. And on the base, at that base, is the primary healthcare system. Then you have the secondary, which is represented by the general hospitals. And then the tertiary is represented by teaching hospitals and federal medical centers, and the specialty hospitals, that is orthopedic hospitals, ear, nose and throat, eye hospitals, are specialty hospitals, neuropsychiatric hospitals. Now, but I'm happy you mentioned, earlier, we talk of what happened under Professor Olikoye Ransom-Kuti, which was under the military.
Yeah.
But then we had a very good primary healthcare system, robust. But then somehow, somewhere along the line, we
jettisoned that
we
policy plan.
We seem to lose it somehow. But I want to commend this present administration because there's a renewed drive to pay attention to the primary health care. And of course, that's where you recall that we have in place National Primary Health Care Development Agency. But for that, we probably wouldn't have got to where we are now in terms of coping and managing polio issues.
Yeah.
In fact, but for COVID-19, we should be preparing now to celebrate the exit of Nigeria from the polio
countries.
Polio countries, exactly.
But tell us, Honorable Minister, you've, as a general practitioner that you are, you've acknowledged the fact that once primary health care was really taken care of, what are the policy plans of this administration? It's not enough to have a department. People say, government is overburdened with department of this, department of that, and because of such bureaucracy, it takes time for policies to come to fruition. What's not just your vision, but the ministry's capacity to achieve, a good primary health care system? That's where majority, the beneficiaries of it, that's where they reside, in the rural area.
Yes. What is being done now as a matter of policy, Nigeria has about 10,000 wards, political wards. And the thrust of this present administration is to ensure that each ward has one primary health center that is fit for purpose. Fit for purpose in terms of being comprehensive enough as to handle the basic health issues. Yes. And what are these? We are talking of antenatal care. We need to do something about our figures in terms of
births and deaths.
Yes, the infant mortality, maternal mortality. We need to address those issues. And they start from antenatal care. The primary health center should be such as to be able to provide immunization. We have a lot of diseases that we refer to as vaccine preventable. Polio, tuberculosis, measles, these are all vaccine preventable diseases. And we need to manage this. 3, basic health education is important for people to know issues of nutrition, particularly in childhood, in early years of life, because the capacity of the brain is a function of what happens in the womb and very, early years of life. So that is why antenatal care is important, so that the pregnant mother can know what kind of nutrition, and of course it has to be monitored all through pregnancy. These are basic things that, and of course, malaria is endemic with us. There is no reason why a normal, uncomplicated case of malaria should even go to general hospital. It is something that we should be able to manage at the level of the primary care if the right things are there. The normal delivery should ordinarily take place at that level, because once we are given antenatal care, we integrate even the traditional birth attendants. We teach them what, in terms of infection prevention and control, very important. And once we're able to do all this, we will have
taken care of.
We will have taken care of the bulk of this. Of course, don't forget there's also this component that a lot of things that happen in health, they are not necessarily issues of health, primarily. For example, potable water. If you have good water supply.
It's not always, is never available in the rural areas. You,
So
and I know that, Honorable Minister.
So this is why we talk of WASH.
Okay. All right. We'll come back to expatiate further on that. We want to take some messages again. You're still watching the Arise interview. We'll still got plenty more still ahead. Stay with us. All right. Welcome back to the Arise interview with me, Christian Ogodo. I still have with us here in the studio the Honorable Minister of State for Health, Right Honorable Adeleke Mamora. Sometimes I want to call him a distinguished senator again. The titles are just so much. So, what's the future of healthcare in Nigeria? Will new policies be formed to suit the post-COVID-19 era? Well, it is said that there is a need for an urgent and radical innovation of the nation's healthcare sector, and both the government and the private sector are working assiduously to improve healthcare facilities at the moment to meet up to the rising global health challenge. And to mitigate the spread of the coronavirus, contact tracing and testing capacity are needed to be stepped up. That's where I'm coming to now. Contact tracing, the PTF, in one of its reports this week, said it cannot put a finger to how over 7,000 infected Nigerians got the corona from. That means there is a little laxity, I would say, about contact tracing.
No, it doesn't mean that. You see, contracts can be contact tracing. You can have when you have a few cases you are dealing with. Like when we first had the index case, of course, as the word says, contact tracing. Starting from all the other passengers who were in that
in
flight.
the aircraft, yeah.
And then tracing who the Italian came in contact with on arrival from Lagos to Ogun, and all that. So it's easy to do that in that circumstance. But the reality is that we have since moved. You see, in terms of the spread of COVID-19, there are three layers or ways: the cases, the clusters, and then the community. We are already definitely in community transmission phase, which is the final phase. And at that point, it's difficult to contact trace, because you cannot just even determine. If you catch it now, you can't even know where it has come from. That is the truth.
But I know the places I go to.
But you may not even know at which point in time, well, who did you pick it from? Because don't forget, over 80% of people coming down with positive for coronavirus, one, they may not even show any symptoms. That is asymptomatic.
Yeah.
Or where they do, the symptoms may just be mild or moderate. It's less than 10%, even less than 5%, that may even require hospitalization. So the whole essence of isolation is to be able, where you identify somebody testing positive, the whole essence is to be able to separate them from
the
infecting. That's the whole essence. And most people will just recover from it naturally through their own immune system. That's all. Just like you mentioned, the common cold. You common cold is part and parcel of the coronavirus group.
Absolutely.
So, and you have common cold, you don't need to take anything. At best, we probably just ask you to have bed rest. And within a few days, you will get over. If you are giving
because it's going to run its course.
Its course.
Naturally.
The body's immune system will overwhelm it, and then you get, provided you don't have some underlying ailments that could compromise your immune system, like tuberculosis, like cancer here, or HIV. Those are the things that could easily compromise.
Trigger.
And if you are eating well, you're taking a lot of vitamins from your food, you will get over. So it's a question of not being able to know where this thing has come from. So, and that's the phase in which we are now, largely in the country. You cannot, so it's difficult to now talk of contact tracing. But in that circumstance, even the more reason why we need to we ramp up our testing, which is being done right now. And don't forget, we have limited ourselves to the use of what is called molecular testing, PCR-based, as we call it. That's what we are doing, and it's increasing. It's increasing on the daily basis.
Have you received more testing kits, to accelerate that increase? Because I remember the Cross River State Health Commissioner on this program complained that they have just about 50, and we said for a whole state of over 5 million.
Well, don't forget that what NCDC does is to give the states based on the number of cases already identified from that. Because if you take, for example, what the test kits that will be made available to Lagos, it cannot be same as what will be made available to Cross River State. Yes, because of the body.
Yes, and Kogi state governments seem to still be at daggers drawn with the agency under your NCDC, saying that the state is COVID-free. But only recently it locked down Kaba, Bunu local government area.
Well, let me just say, at least here, that we are trying to resolve whatever.
What is it exactly?
Well, I think it's just a matter of seeming gap, I will say, in communication. Because as far as I know, NCDC is doing what it should do. The NCDC is a national agency under Ministry of Health that has clearly spelled out assignment from the NCDC Act. And the major part of it is to support the states. We will not absolutely dictate to the states what to do, but we have a duty to support them in what they are doing, because response activities to COVID-19
issue.
Yes, these activities are based on one national response.
But only recently you relaxed the lockdown and kind of handed over the protocols to each state to manage and follow. Now doing superintending some of these. Some people wonder that the country's COVID-19 graph or curve is not flattening, and yet 90% of the lockdown has been relaxed. Is it because it is said that the infection isn't really spiking in Africa with attendant deaths and the rest, like we saw in Europe, the Americas, and Asia?
Well, we thank God for making it that way. But having said that, it's not just an issue of relaxing because of one pressure here or there. No, there are so many factors. One is the issue of data. We have data that we look at, and in addition to this data, we do what we call modeling. And modeling is based on science. That what is likely to happen when you do this? What is likely to happen when you do that? So all these things are put together and properly analyzed. There are experts who are even working behind the scene.
Yeah.
Who sit down and do this analysis based on data, based on science, and come up with one position or the other. Two, we needed to, of course, we knew that we were yet to even reach the peak. We hadn't, because ideally you reach the peak, and that is when you are no longer really having new cases in such large.
It starts flattening.
Then you want to talk of flattening and all that. But again, we necessarily had to balance health security with economic security and livelihood. There are people who go out there on a daily basis to earn or eke out a
That's
living.
because the government does not have the capacity to take care of them. We saw in the distribution of the palliatives to the people.
And don't forget, no matter what government does, it will be extremely difficult to reach everyone who needs the palliative.
What's the difficulty? Nigeria is a rich country. What is difficult about giving food to the people, 3 square meals?
The difficulty is not just in the issue of financing. There is a cost element to this, whether we like it or not. Don't forget again the resources available, financial resources. The resources have been further depleted, further compromised by the reality of COVID-19 itself. So that issue is there, and it's a reality. Two, even the infrastructural facility required is also huge, both in terms of physical and human. You need human beings one way or the other to distribute the things available.
Maybe I should just sound a little hilarious, but the NEPA, as they say then, they are capable of distributing electricity bills to the nook and cranny of this country. So they probably should have been used to distribute the foods, and it will get to the people.
Electricity bills distributed, they are distributed to houses, dwellings, not to individuals.
Yeah, but
they are two different things.
Yeah, you can do that to dwellings. When I say individuals, I'm saying dwellings.
If a NEPA official has to deliver this at number 9 address, number 9 address is just one house.
Yeah.
In that same house, you may have 15, 20 people there.
Sure.
That's a different scenario.
Really?
So it is.
Okay.
It is. So these are some of the things that are involved. And of course, in doing this thing, it also has to be gradual, the relaxation. You can see that in the first instance, when we thought in about 2 weeks, we had to push it forward because of realities, because you are continuously reappraising. And the situation on ground, you review it. If we have to go back, we will go back.
Okay.
Yes,
okay.
That's the truth.
Let's leave it there for now and take more messages. And when we return, we'll see what the future holds for COVID-19 in Nigeria. You're still watching the Arise interview. We'll still go more to discuss. Stay with us. You're welcome back to the Arise interview with me, Christian Ogodo. We're live in Nigeria's capital, Abuja. We're on the last lap of the Arise interview with the Honorable Minister of State for Health. He's also a former distinguished senator of the Federal Republic of Nigeria, as well as one-time speaker of the Lagos State House of Assembly. Now, one critical area, innovation, that COVID-19 has brought is the exploit of technology. One would have, expected Nigeria with a 13% growth and contribution to the GDP, I'm talking about ICT and technology, that your ministry should be collaborating with the Ministry of Communications and Digital Economy to get an app tracing and tracking device for COVID-19. Is there anything like that?
Yes, Christian, I can tell you that we are leveraging on this, even if it's in the background. We are, and a great deal. You see, look, NCDC, with all the monitoring, contact tracing, and all that they do. They have an app, SOMAS, as they call it. It's what they use to do some of these things. So it's there. And then, of course, I told you that all this data and, what have you, modeling and all that, they are all conducted through one app or the other in the background. And they are then analyzed for us to take decisions and make recommendations to Mr. President as to what he will want to do in the circumstance. And of course, the FEC meeting now, in the last 3 meetings we've done virtually and very successful.
Yeah.
We probably wouldn't have done that if we didn't have COVID-19. So in every seemingly bad situation, you could have some good coming out of it.
Absolutely. That is the new normal everybody is talking about.
So, yeah. I mean, so many webinars that we've had.
Absolutely.
Virtually on a daily basis. Somebody is calling you, we want you to be on this webinar, and then you...
And that's going to have a real run. How I wish you were the typical civil servant, the secretary to the government of the Federation, or the head of the civil service of the Federation. I would have asked you that isn't this COVID-19 going to impact heavily on government officials who are traveling for one seminar or the other and the rest? The ESTA code is gone. Ticket money is saved. Cost of governance will be going down, isn't it?
The things you have said, they are realities which we must live with. And that's the truth.
Good.
Yes.
Nigerians will really be happy because the government will be saving a lot of money.
It's for the good of us all.
Absolutely.
Yes.
Now, let us look at the devolution of the PTF's powers to the states and the rest. Enormous work you've been doing. I mean, briefing every day, Mondays to Fridays. Phil has added that the president enjoys it. Even when you said you wanted to do it twice a week, he said, no, continue doing it daily and the rest. But what kind of responses have you gotten from the states? We know that the states too are putting in their own protocols, taking a template from the national level. But how do you monitor compliance here? And can there be a need for a reversal of the present situation?
If and when the situation so dictates, we will not, and that's why we will come open to Nigerians that we are doing this for this purpose at this point in time. And we have always said that if the need warrants it, if the situation so dictates, we will not hesitate to go back to Mr. President and table the facts before him to enable him take decision, because Mr. President is the final person who takes decision. We are just, he appointed PTF members. We will just advise.
As his eyes and ears.
So, yes. So, now, we are in a federation. And the states, as they are right now, they are like the federating unit. And our own federation is what you can call cooperative federation. And to that extent, what we do is to a lot of times, I mean, we have engagement. And there's no federation that is perfect. Even in America, that has been at it for over 200 years. You saw a lot of situations, where Mr. President was grappling with, some states.
Whether lockdown or
lockdown. So,
and they rebelled.
So what we are saying is there is no perfection in this thing. But the most important thing is to constantly engage.
Okay.
And that's what we are doing.
And that is ongoing.
And it's ongoing. Okay. And of course, we support where we need to support.
Okay, Honorable Minister, we've got just a very few minutes to go. Very quickly, the hazard allowances for health workers, have you started paying them?
Seriously, we haven't started paying, and I regret saying this. It's not because we have, in fact, it's not as if we don't want to pay. No, a lot of things happened that disrupted, the it's an issue of having to get the nitty-gritty put together, and it's not just the health, it's not just the Ministry of Health issue. It involves the Ministry of Labor, Employment. It involves finance, budget and economic planning. It involves the National Salaries Wages Commission. So a whole lot of, we still had a meeting yesterday. It's just to, in principle, it's done. But in terms of actualization, that's just what we are trying to dot the I's and cross the T's.
Okay.
Yeah.
Let me ask you what has been agitating the minds of Nigerians. Where are those Chinese experts that the federal government and your counterpart in the ministry went to visit, to receive at the Nnamdi Azikiwe airport? Where are they today?
The last I heard was that they are back.
You heard?
Yes, I heard.
They didn't come
Don't
to do
forget,
the job that
don't
you said
no,
they
no,
were
no,
coming
no,
for?
no, they did. They did what they were part of these days dome construction.
And
Yes,
fitting
of course.
the equipment.
They were part of it. They were part of it, and the consultants that the experts in the medical field that came with them, they gave consultancy support to the whole project.
Okay, that's
Yes.
great. Now, let's talk quickly of COVID, the private sector initiative in supporting COVID-19. How enormous support have you been getting your
In
ministry?
fact, I cannot thank them enough, because this is what is expected. This is what humanity expects, and I cannot thank them enough because they have done so much, and they are still doing. I thank them so much for what they have done, which we appreciate. We do not want to. We don't want to take it for granted. They have done so well, which we will continue to be grateful for.
Thank you so very much, Honorable Minister for State Health. Doctor, let me even add that, because I know you're a GP, Dr. Adeleke Mamora, for being our guest on the Arise interview.
Christian, thank you very much.
They don't shake it.
Yes,
we'll
you know,
this.
in
Yeah,
fact, that would have been an abomination, if not a sacrilege.
All right. All because of COVID-19. Yeah. Absolutely.
Thank you very much.
That's it for this edition of the Arise interview. Do join us again tomorrow. From me and the entire team here in Abuja. Goodbye, and thanks for watching.